Okay, you've been through your surgery, you've had some time to recover in the hospital, and now you're ready to start your recovery at home. So here are some helpful hints that may help you decide the best possible recovery for you. But first, a quick disclaimer. This video was created to give heart patients some tips to help them with their home recovery. I'm not a doctor, I'm a heart patient, just like you, or possibly someone you know. Before leaving the hospital, you will meet with a discharge nurse who will go over any medications that your doctors may have prescribed. You will also receive some instructions that you can take with you on a variety of subjects. So let's talk about a few of them. Let's talk about bathing. You can take a shower every day once you go home, but no baths until you are completely healed, which is about 7 or 8 weeks. For the first few days, try to have someone nearby when you shower, just in case you need some help. Any type of antibacterial liquid soap, I like the kind that comes out in a foamy ball, works great for cleaning your incision. Just put a big foamy ball in your hands, roll it up your incision, let the water hit you on the back, and allow the water to flow over your shoulders to rinse off the soap. Don't use very hot water, and don't scrub your incision or the skin near your incision. Okay, let's talk about exercise. The best advice I can give you is listen to your body. If your body is saying get up and go for a walk, then you should get up and do just that. But if your body is saying sit down and take a break, then you need to take a break. That is just as important. You need to listen to both sides of the spectrum. Always warm up a bit before your exercise, and don't forget to take some time to cool down as well. You may be given some general guidelines for your exercise, and this may help you to decide what works best for you. Remember, if you're experiencing any angina or chest pain, stop exercising, and if it persists, go to the nearest emergency room and get yourself checked out. Most hospitals that have a cardiac program also have a cardiac rehab unit that I will tell you more about a little later. Let's talk about stairs. I'm asked all the time, can I go up and down stairs? I find that with most of my patients that if you went up and down stairs before your surgery, you should be able to go up and down stairs when you get home. But let's add a few caveats. The first time you go up and down the steps, have someone with you. Think about it. You've been less active during your hospital stay. You may have been on some new medications. You may be just a bit woozy. It would be best to have someone there with you just in case you lose your balance. And while I'm on that subject, if you ever feel yourself losing your balance and you think you might fall, just sit down. Don't try to catch yourself. If you grab hold of something and give your arm a good yank, remember, arm bone connected to breastbone connected to wires. You get the picture. After a good yank, you may be back at the hospital having your incision and wires checked. It's a lot easier to pick you up onto your feet than it is to transport you back to the hospital. Let's talk about driving. It is okay to be a passenger, but you should avoid long trips for at least a few weeks, or at least until you meet with your surgeon for a follow-up visit. On the ride home, and for at least a few weeks, I recommend that you ride in the back seat, if at all possible. 4-door cars make it easier. If you are in the front seat and God forbid there is an accident and an airbag goes off and hits you in the chest at 300 miles an hour, you will definitely be back at the hospital for a visit. If you are sitting in the back seat with your seatbelt on and there is an accident, there is probably very little chance that you will fly forward and hit the back of the front seat. Having said that, if either case were to happen, get yourself back to the hospital as quickly as you can so that you can have yourself checked out. And remember that heart-shaped pillow that you were given to help with coughing? It's great to tuck in between your seatbelt and you. It's a great little padding because no matter where you sit in the car, your seatbelt goes right across your incision. Now, as a driver, why we ask you not to drive is because we don't want you to be put into a situation where you need to react quickly and you fail to do so because you have a broken bone in your chest and an incision. If you hesitate, it may already be too late. The closer you get to the 6 weeks it takes for your breastbone to heal, the better. You can discuss this with your surgeon on your follow-up visit. And by the way, riding mowers, bicycles, snowmobiles, motorcycles, even horses all fall into the driving category. Let's talk about support stockings. You will already have worn these while you were in the hospital. They will help with circulation in your legs and will help to reduce swelling. They should be worn for several weeks and should not be worn while you sleep. They can be difficult to put on, so have a friend or a family member give you some help. Now let's talk about visiting nurses. Your hospital may arrange for you to have a visiting nurse when you go home. Depending on your needs, a schedule will be established and the nurse will visit you at your home. He or she will go over your medications with you, look at your incision to see how it's healing, take your blood pressure, listen to your heart and lungs, and weigh you. You will be asked to keep track of your weight on a daily basis after you get home, and if you find yourself gaining weight quickly, be sure to call your surgeon and/or your cardiologist as you may be retaining fluid. Your doctors will tell you what to do next. Also, if you are having any difficulty breathing, be sure to tell your nurse and/or call your doctors immediately. As always, go to the nearest hospital emergency room if you are experiencing any unusual amount of discomfort. Now, when you get home, you will have about 3 weeks of what I call mostly good days and maybe a few not so good days. By not so good days, I mean that if you overdo it a bit, you will be hit with a wave of exhaustion, sort of like the type that was described when you first were waking up after surgery. It's kind of your body's way of letting you know that you have overdone it a bit. I always tell patients I meet with after surgery that the best advice that I can give you, as I said earlier, is to listen to your body. I have some patients who think that they should be able to walk 7 miles on their first day home. I think you'll agree that that's kind of ridiculous. But I have another group who thinks that using their TV remote is the only exercise they need to get. That's just as ridiculous. Someplace in the middle is you. I just don't know where that is. It's up to you to find it. Listening to your body is the best way to find what level of exercise that is just right for you. If you do what I suggest, you are on your way to a great recovery. Your second set of 3 weeks, your breastbone finishes healing, which, by the way, takes 6 weeks to heal. During that 6-week time period, don't lift anything heavier than a half a gallon of milk. That is a good rule of thumb. I can't stop you if you decide to cheat, but if you ever choose to do so, do me a favor, cheat on the 4-week side and not on the 1-week side. In the first week, the only thing holding your breastbone together is that titanium wire that we talked about. 4 weeks from now, at least some bone has been growing, and there's less of a chance that you could injure yourself. To put it simply, if you're ever standing there asking yourself, I wonder if I should be lifting this, we already know the answer is no. So don't do that. In the balance of these 3 weeks, your incision will also heal, and at about 7 weeks after surgery, your life begins to go back to normal. As I mentioned earlier, generally about 5 or 6 weeks after surgery, many patients will begin their cardiac rehab. Be sure to contact your insurance company to see how your cardiac rehab is covered. Some insurance companies consider each visit to rehab as a separate visit and will charge you a copay for each visit. It's just a good idea to check how your insurance company will handle their coverage. And here's a few more tips. When your incision begins to itch, and it will, take a terry cloth towel that is dry, fold it into a square, and hold it against your bare chest and slide it up and down. It will scratch your itching, and you won't have to poke at your incision. It's also a good way to scratch the incision on your leg as well. And just for the record, the top of your incision will itch way longer than the rest. When everything else is long since healed, you will still be scratching the top. If you're a back sleeper, it is possible to sleep sort of comfortably if you prop yourself up a bit with some pillows. If you're a side sleeper like me, you will not be able to do that with any degree of comfort for about 3 weeks or so. In either case, I recommend that if you have a favorite chair that you like to sleep in the chair for a few weeks. Sleeping in a chair stops you from rolling on your side because when you do so or crunch up, your skin moves and it makes you go yikes, and then you're awake. And if you've been sleeping long enough that you can't get back to sleep, then you'll be up all night and usually feeling pretty lousy the next day. Sleeping in a chair takes most of that away. Another trick is to put some pillows on your lap and put your arms in about this position. This will raise your arms just a bit and make the muscles in your chest weightless. This makes you feel much more comfortable. I slept in a recliner for the first 2 weeks I was home, and that restful sleep helped me to feel much, much better. Also, you will be going home with some pain medications. I found that if I took a pill about an hour before I went to bed at night, it made me a bit sleepy and it helped me to fall asleep. And it also took away the little sort of ouchies that would have normally kept me awake. The choice is yours. But I found that if I took the pain medications during the day, I was awake at night. See what works best for you. Consult your doctor for some advice. Pain medications are going to bind you up just like they did in the hospital. I suggest you take some stool softeners with your medications. Also, it wouldn't hurt to have a little Miralax around the house. If you drink it with some fruit juice, you can't even taste it. It also works over time, so it isn't like you're running to the bathroom almost instantly. It helps to suck water into your colon, and that helps you to go easier. By the way, if you choose to drink fruit juices, drinking them at room temperature seems to help things get going again better than if you drink the fruit juice cold. There's also some new medications that can help you with constipation as well. So if you're having difficulty going, contact your doctor. He may prescribe one of these new medications. Let's talk about your appetite. You may or may not have one after your surgery. Some patients wake up and their appetites are just fine. Others, like me, can go several weeks until they want to start eating again. So, if you're like me, I suggest that you pick at whatever it is that you like the best. Just nibble, nibble, nibble. I don't care if it's peanut butter crackers or soup, but whatever you like, pick at it. About 25% of your caloric intake is used for healing, so if you're not putting any calories in, you're just slowing things down. In time, things will go back to normal. Be patient, and be sure to tell whoever is doing the cooking that it isn't them, it's you. You might find out that you even like some new foods that you never liked before. I did. Okay, remember that incentive spirometer? It's a great little tool to help you with your breathing. You used it in the hospital after your surgery. Be sure to take it home with you. When you don't think you need it anymore, pick it up every once in a while and take a few deep breaths. You don't realize it, but as you are healing, it's natural to take more shallow breaths. Doing some breathing exercises helps you to take more natural breaths. Your family, friends, and coworkers will make you a little bit nuts for a while. You will be bombarded with comments like, your color doesn't look good, do you feel okay, did you take your pills today, don't lift that. The list goes on and on. If they get to be too annoying, I suggest you say something like this to them. I appreciate you asking me these questions, but I'd like you to know that
every time you ask me one of those questions, you kind of slingshot me back into that place that says I'm not back to normal yet.
And I'm trying to do my best to get back to normal. They'll leave you alone for a little while, but don't worry, they'll be back. And the last two things. First, it is not unusual to go through some very emotional highs and lows after open heart surgery. It may happen in the hospital, but it is more likely that once you get home and have some quiet time alone to think about what you have been through, that you may experience dreams, frustration, anger, sadness, and a sense of wanting to cry one moment and then you're giddy the next.
Okay? Yep.
Let me say that it's all normal. It's part of the process. Different people experience different emotions. For some, it can be very traumatic, and for others, it can be just a bump in the road. But we all seem to experience something. If you experience these emotions, I suggest you do one of two things. First, talk to the people who are around you. They're all friendly ears, and they're willing to listen to what it is that you have to say. But remember, they will have no idea about what you are describing. We will both know what that first day is like, and we will share a kinship as a result of that experience. They can't possibly understand unless they too have been through heart surgery. Second, if you don't want to do the first thing, then sit down with your computer or a piece of paper and a pencil and write a note to your favorite nurse telling them how you feel about what you just went through. If you do either of these two things, I can promise you that most of the time the feelings will go away. Hey, I'm not going for let's embrace the feelings here, but if you deal with the feelings, most of the time they will go away. Most hospitals have heart ambassadors like myself that can talk with you and who have shared similar experiences. There are also psychologists that are specially trained to work with cardiac patients and clergy as well. It is becoming more and more the norm that caring for the whole person is and should be our ultimate goal. It is important to recognize that your family members go through the same set of emotions as you do. So share these tips with them also and let them know that it's okay to talk with you about how they are feeling as well. Okay, you're about as ready as I can get you. I wish you good luck with your surgery, and I wish you a speedy recovery. If you found these videos to be helpful, please let me know. Let me know how your recovery goes as well. You can always send me an email at aheartbeatawayforyou@gmail.com. I would like to take this opportunity to thank Dr. Todd E. Nixon and Dr. Jeffrey Valouz, both of whom are cardiovascular surgeons, for their valuable contributions while making this series of videos. I would like to thank Arisen Media, Arrival Video Productions, Mr. Rick Lombardi, Mr. Scott Randolph, and everyone else who was responsible for the production of these videos. Good luck and God bless.